Welcome to another episode from the Veterinary Research Channel. Today, we delve into a retrospective study that sheds light on granulomatous hepatitis, GH, a form of chronic hepatitis in dogs. This research, published in the Journal of Veterinary Internal Medicine in 2023, is titled Characterization of Clinical Presentation, Histological Features, Ultrasonographic Findings, and Survival in 29 Dogs with Granulomatous Hepatitis. The study, conducted at the Cummings School of Veterinary Medicine at Tufts University, aimed to describe the clinical presentation, clinical pathology, ultrasound, and hepatic histopathology findings in dogs with GH, as well as to report their survival times. The researchers hypothesized that dogs with GH often present acutely ill, with fever, high-grade biopsy material, and a high frequency of abnormal ultrasound imaging findings. To conduct this study, the Electronic Medical Record Database at the Cummings School of Veterinary Medicine at Tufts University was searched for cases of GH between 2010 and 2021. The inclusion criteria were strict. Each dog needed to have a hepatic biopsy sample that was adequate for diagnosis, a morphologic diagnosis of GH based on published guidelines, and a medical record available for review. Dogs were excluded if they had evidence of extrahepatic granulomatous disease or positive diagnostic tests for infectious diseases known to be associated with granulomatous inflammation. In total, 29 dogs met the inclusion criteria and were included in the study. The median age of these dogs was 7 years, with a range from 0.66 to 12 years. 19 breeds were represented, with Labrador Retrievers being the most common. The researchers collected data on signalment, history, clinical signs, physical examination findings, and results from complete blood counts and serum biochemistry tests. Hepatic histopathology reports, copper assessments, ancillary testing for infectious organisms, bacterial culture results, and ultrasonographic findings were also gathered. Treatment information was recorded and categorized. A clinical severity score was calculated for each dog at the time of biopsy. Now, let's move into the results of the study, offering a detailed look into what the veterinary team discovered. The most common clinical signs reported were decreased appetite, lethargy, and fever. All dogs had increased serum activity of alanine transaminase, ALT, and aspartate aminotransferase, AST. Many also had hyperbilirubinemia and neutrophilia. Of the dogs, clinical signs included decreased appetite, 19/29, lethargy, 16/29, fever, 13/29. All of the dogs in the study had increased serum transaminase activities. Serum alkaline phosphatase, ALP, activity was increased in 28/29 dogs. Serum gamma-glutamyl-transferase, GGT, activity was increased in 6/27 cases. Total bilirubin concentration was increased in 17/29 dogs. Hypoalbuminemia was present in 9/29 dogs. Leukocytosis was documented in 12/27 dogs. Mature neutrophilia in 12/24. Anemia was reported in 6/27 dogs. Thrombocytopenia was found in August 29. 22 dogs had ultrasound examination findings available. The most common findings were changes in echogenicity, hepatomegaly, irregular margination, presence of nodules, and presence of hypoechoic parenchymal bands. The most common ultrasound findings were changes in echogenicity, 82%, hepatomegaly, 50%, irregular margination, 50%. Presence of nodules, 41%. Presence of hyperechoic parenchymal bands, 36%. Hepatic biopsies revealed granulomatous hepatitis in all 29 dogs. The majority of dogs had moderate to severe necroinflammation, and some had moderate to severe fibrosis. Hepatic copper was evaluated, and some biopsy samples had increased copper scores. Some dogs had hepatic copper concentrations greater than 400 micrograms per gram dry weight. Treatment protocols varied but included antibiotics, immunosuppressive drugs, and hepatoprotectants. Resolution of clinical signs occurred in 1826 dogs, and normalization of serum ALT or AST activity was documented in 1526 and 1826 dogs, respectively. The median survival time for all dogs was 635 days. The study found that granulomatous hepatitis in dogs is associated with high histopathologic grade, fever, neutrophilia, and a high incidence of hepatomegaly and focal parenchymal lesions on ultrasound examination. Despite disease severity on presentation, dogs with GH can have a good outcome with prolonged survival. Now, let's discuss the implications of this research by highlighting some key points for clinical practice. This study highlighted key differences between GH and the more common lymphoplasmacytic variant of chronic hepatitis, CH. The research revealed dogs with GH often present with acute clinical signs such as fever, anorexia, and lethargy. This is in contrast to many dogs with CH, who are subclinical at the time of diagnosis. Key differences between granulomatous hepatitis and chronic hepatitis: dogs with GH are more likely to present with acute clinical signs, including fever, anorexia, and lethargy. Dogs with GH often have abnormal imaging findings and high-grade hepatic histopathology changes. Neutrophilia is a common biochemical finding in dogs with GH, but is uncommon in dogs with CH. Hepatomegaly and irregular liver margins are more common in dogs with GH. Hypoechoic periportal bands and hyperechoic nodules with a hypoechoic rim are newly reported ultrasonographic findings in dogs with GH. The finding of hyperechoic periportal bands and hyperechoic nodules with a hypoechoic rim on ultrasound should raise suspicion for GH in dogs presenting for evaluation of hepatic disease. Furthermore, the results suggest that dogs with GH may benefit from immunosuppressive treatment. A common therapeutic strategy was to treat for infectious disease with antibiotics and, if the dog failed to improve, add immunosuppressive drugs to the treatment protocol. Dogs managed using this strategy had good long-term survival. In conclusion, this retrospective study provides valuable insights into the clinical presentation, ultrasonographic imaging findings, histopathological grading and staging, and survival time in dogs diagnosed with GH. The study highlights the importance of considering GH as a differential diagnosis in dogs presenting with acute clinical signs and characteristic ultrasound findings. The results also suggest that immunosuppressive treatment may be beneficial in these cases. This study had some limitations. It was a retrospective study, so not all records contain the same amount of information. Diagnostic evaluations, treatments, and monitoring protocols varied among dogs. Also, not all dogs underwent extensive infectious disease testing. It is also noted that there is variability in hepatic biopsy interpretation. Further prospective randomized clinical trials with standardized treatment protocols are necessary to further define the optimal management of dogs with GH. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.